And we are back with the Boston Congress of Public Health with the 40 Under 40 Public Health Catalyst Awards. We have another winner with us, Lianne Hope, that we will introduce. And we just wanted to mention that the 40 Under 40 Public Health Catalyst program represents the next generation of leaders, entrepreneurs, researchers, scientists, activists, intellectual provocateurs, authors, and directors who are inspiring and catalyzing us to a more just and equitable world. So thank you all for tuning in. So Lianne Hope is the founder of Hope Consulting Group, amongst many other things. So I will just let you jump in. Lianne, tell us more about yourself.
Sure. So as you said, I am the owner of and the founder of Hope Consulting Group. This is my consulting company that I started about 4 years ago. And I definitely went through a journey to get to the point where I started my own business. But to just talk a little bit about Hope Consulting Group, I primarily focus on project management and work primarily with various health departments. And it's just worked out where I landed in mostly HIV services through the Ryan White program, which is a federal grant, and as well as COVID response. And so it's been really wonderful becoming a consultant for so many reasons. But it's really, I think the thing that I love the most about it is that I get to work with so many different types of people from all over the country, and really get to understand the needs of all of those various communities. But a little bit more about the journey and how I got to my consulting company. So um, I'll first say that I am Chinese American. I am an immigrant, and I grew up in the Bay Area, the San Francisco Bay Area. And it wasn't until I went to college that was I contracted my first STI, and I was mortified. And it inspired me to really understand why this happened. And what I realized was that the structures in place, such as my school, were not providing a lot of sexual health education. And so that kicked my butt into gear. And I took on an independent study, and I surveyed a lot of students, and come to find out that the number of STIs among our student population was reflective of the national statistics. And so with that, I didn't even know what public health was at the time. I really just, I followed my nose, and I said, you know, what we need to do here is use these data to then create health promotion and sexual health programming. And so that's exactly what I did. And that then led me into a career in public health, where I ended up going to grad school for public health and social work and doing a dual degree program at Boston University.
Wow, I find that journey amazing, and like of the other interviewees for the 40 Under 40, their personal stories as well, right? Something very interesting and provocative, and even jarring sometimes happened in their life, and that kind of led them to the field of public health. So thank you so much for sharing that, Lianne. And if I can just kind of segue back, so you talked about being from the Bay Area. Are you currently calling in from that area right now?
Well, technically, no. I'm actually calling in from Boston. I happen to be on a trip here, but
Mhm.
I do live in Oakland. That is my home base. However, I'm enjoying the Boston summer and the heat and humidity, and just working from here.
Okay, that's awesome. So getting back to your consulting group, so you said you're able to work with a variety of different communities. Are there a couple, 1 to 2 projects that you're particularly proud of, that are interesting, that you would like to share with the audience?
Absolutely. I think the one that I want to highlight the most is that the when I joined forces with Alameda County Department of Public Health, specifically their COVID response team, was an incredibly impactful experience for me. So last year in 2021, I had lost my previous contract unexpectedly, it was a really tough time for me. I had also lost my mother, and I'd also ended a relationship, and so it was sort of my dark night of the soul. And I had decided that, I really want to be a part of the COVID emergency response. And so I reached out to Alameda County. They then had asked me to come on board to design and launch a, a vaccine incentives program, which a lot of different health departments were doing at the time, just to try and incentivize people getting vaccinated. So it took a couple months, but we got it through all the the department portals, and and we ended up, along with me and along with a team of people, we went out to all the vaccine clinics, and we offered gift cards for folks to get vaccinated. And the reason why I feel that this was so impactful is because the idea that I may have saved some lives because of people choosing to get vaccinated is probably the highlight of my career. So I and so I so that's the first one. The second one, well, there's so many that I can highlight. I actually would love to highlight this second um, project that I'm doing. So, and Candace, you can tell me whether it's because this project that I'm doing is not quite associated with my Hope Consulting Group. It's kind of like my next steps for what I want to do with health promotion.
Sure, absolutely. Please do share. It doesn't have, I know I did specifically ask for Hope Consulting Group because that's the thing I could latch on to. But yes, anything within your professional life or volunteer life that you feel is relatable.
Great, great. So I'm working on this new project. It's called The Place, and place is spelled with a Y in it, so PLAYCE. And what we are trying to accomplish, me and my business partner, is to allow adults to access play. And the reason that we're doing that is because we're recognizing that adults are play deprived, and that there's a body of research that shows that it's not just kids that need to play. And by play, by definition, we're talking about activities that no one needs to do, but that inherently um, is fun. That when people are playing, they're losing track of space and time, and they're kind of going into this flow, and they it's so fun that they want to do it again. And so the reason why we're doing this is to really address some of the disparities that we have been seeing, especially during COVID, to reduce isolation, to reduce the anxiety and depression that really spiked in the last 2 years, to help get people's bodies moving, to reduce chronic pain, for example. And so this is absolutely, even though it's atypical to what we see in public health, it is absolutely a health promotion program. So we launched 2 months ago. We've held 2 events already. The events went really well. People really loved it. And so the possibilities of this project are endless, but we certainly hope to keep growing it to reach different populations. We definitely want to center folks of color, because we know that, especially in the last 2 years, that some of the health disparities that I mentioned, they were adversely and disproportionately impacted. And so we just want to keep bringing this to POC communities, queer communities, to really convince folks that playing should be an essential part of our lives and our self-care. So it's something I'm very, very proud of.
I absolutely love that. And I wanted to recognize what you said when you said the dark night of the soul and how that prompted you into, that vaccine program that you created, which I mean, I think is phenomenal, the lives that you were able to save. And then also place, the play deprivation, which I don't think people talk about a lot. And I actually agree that is a public health issue because, as you said, it intertwines with increasing rates of anxiety, depression, suicidality, some other things as well. I'm curious, Lianne, as a physician, I'm someone who doesn't get a lot of play, so I'm play deprived as well. So I'm just curious, like as you're thinking about this project, are you thinking about differentiating it based off of one's career? Because it can be a little different, a little tricky for people who say are self-employed and freelancers. Or have more of that 9 to 5 versus those that have like a more rigid and unforgiving schedule.
Right. And I think what you're pointing at is that there are barriers to people participating. And so one of those barriers that we heard in our focus groups was, I don't have the time. With our jobs, with children and other responsibilities, how can I possibly make time for this? So we want to be able to produce uh, events that are as low barrier as possible. And this is still a work in progress. So far, what we're doing is making these events free, making them at public parks that are accessible through public transit. They are not long events, but you can basically just the culture is you can just stroll in whenever you want. You can stay for as long as you want. You can stay for an hour. You can stay for 3 hours. And eventually we definitely want to have resources for adults with children that they can bring their children with them to play games together as a family. Or there's two separate areas, one for the adults and then a separate area for the children, where they can still feel like that their children are safe where they are, but that they are able to have their own experience separate from their child. And so, it's going to be, I think there are certain people that will say, they won't come because they don't have the time. But if we can convince some of those folks to make time and tell them about how our programs are going to really have a positive impact on their life and the way that they interact with other people, then hopefully we can convince those folks to come.
Yeah, I love that. And I was just thinking about also if, there are ways to convince, say, hospital administrators or other, corporate bosses to be able to buy into this, to allow, to give employees time to be able to come and participate in these sorts of things.
Yeah, and the other thing as you say that is we also are going to other people. So already what we're noticing is that there are corporate teams, or even teams at community-based organizations that are emailing us and saying, "Hey, can you guys come to us and do some activities with our team, because we've been looking for something to do together and we couldn't figure out what it is and we'd like you to go." And so maybe what the model is going to end up being is that, not only are we having these events where people can come to us, but that we're also able to bring games to employees that maybe don't have the means to get to us. We can bring the games to them.
That's great. And I'm hoping that's coming to, a hospital near me. I just wanted to transition just a little bit, so we talked about play deprivation, and, some other public health issues. Lianne, in your journey, doing public health as well as social work, what are some of the top of mind public health issues for you that we may not have discussed, that you feel maybe get short shrift in the typical public health discourse that you'd like the audience to be more mindful of?
Oh, that is such a good question. Well, I think because I have worked in HIV for so long, that's the first thing that comes up. I have a lot of clients that tell me, we don't see the, especially when it comes to HIV stigma. I hear that a lot, that we don't have enough anti-stigma campaigns out there to try and reduce stigma because, despite what people might think, that still exists. And so I always want to be honoring my clients who have gone through a lot over the past few decades, and honor what they see and what they feel, which is they're still experiencing stigma, and that we need to be paying more attention to. We can't abandon some of those messages that we would see in earlier decades when it was still considered an emergency, that we still need to be working on reducing different types of stigma, including HIV stigma. So that's the first thing I want to mention. I've already talked about play and play deprivation and really advocating for that to be a part of people's self-care. And I think leading into that is the concept of community healing. I don't think that public health talks about that enough. But I think there is so much overlap between when we talk about social determinants of health, for example, we talk about communities with all of these health disparities. The component that we're really leaving out is really kind of the more spiritual community healing aspect that is a part of all communities. All communities have some type of spiritual practice that is so critical to people's wellness and well-being. And so something that I would want to advocate public health to really focus on is to incorporate some of those aspects of community healing and spiritual practice into how we assist communities in becoming healthier.
Yeah, that's great. And is there like a specific example that you can think of, that you have done or you've seen others do where we're really helping that spiritual component to communities that might be marginalized and or disadvantaged?
Absolutely. Yeah, I think the first thing that comes to mind is a few years ago when I was working with refugees. And I worked with refugees from Uganda. I worked with refugees from a number of Middle Eastern countries. And what I noticed is that they sometimes had some hesitance in some of the medical recommendations that were given to them. For example, certain medication adherence, because maybe upon taking them, that they were experiencing certain symptoms that were unwanted, but there was an association with their spiritual practices in terms of what those symptoms symbolically meant. And so this is just kind of one example of many in terms of how we need, as public health professionals, need to be thinking about those components when we're working with our clients and making our recommendations as culturally appropriate and accessible as possible so that there can be some mutual understanding. Just another example is that a lot of my clients that experience depression and anxiety due to, the trauma that they experienced from their country of origin or from the transition and coming to their host country, caused a lot of, again, depression and anxiety. And so for some of them, talk therapy wasn't enough to really help them to kind of move forward with their lives. It actually took them finding a spiritual community, either a church or some type of practice such as yoga and meditation, before they were able to really become more self-sufficient and have reduced anxiety and depression symptoms. So this is what I mean when I say in public health, when we're working with communities, especially communities that are brought together because of their religion, that we really need to think more critically about those practices and see how they can be blended with some of the public health recommendations that we are disseminating.
Yeah, I think that's so true, resonates very strongly, and had another interviewee who spoke about just the cultural appropriateness and relevance, of public health in targeting and helping to do to help do good as opposed to cause harm, right? Because there can be inadvertent unintended consequences to public health campaigns that are culturally inappropriate and discordant. right?
Absolutely. Absolutely. Yeah. I think that happens a lot. And it's, of course, as you say, unintentional. However, if we took the time to think a little bit more critically and to have more conversations with communities about what they need versus us sort of, okay, here's the research, here's the needs assessment, here's the solution. There's so many steps in between that that require a high level of critical thinking and a high level of empathy and humility for the community that we're working with to be able to find a solution that isn't going to cause harm.
Lianne, as we're talking about this, I'm so fascinated, and I'm wondering, say for instance, there is a public health campaign, and there are unintentional, you know, um, consequences, to a certain community. From your perspective, what are ways that that a public health practitioner, or group can be able to, I guess, undo those things, be it via it's a policy that went wrong, or some program on the ground, because it's well and good to be aspirational and say we're going to think of everything at the beginning, we're going to be very critical, and everything's going to be culturally relevant, and then we're going to go ahead and slap it down. But I feel like so much in reality is that things still happen very quickly, and then we're left dealing with something that isn't the way we intended it. So what do we do in that circumstance?
That's such a great question. And I wish I had a textbook answer for you. I think it really depends on the context of
Mhm.
what kind of harm was caused and and who's involved. And sometimes, honestly, I mean, I've been in situations where there has harm that's been caused, and it wasn't easy to solve, and it actually didn't get. There wasn't a great solution. We actually had to just sort of go our separate ways. I will say that some of the things that I have done in my practice is to create spaces for all parties to come together um, and voice what happened. You know, you can call it whatever you call it, a healing circle, you call it, but it's basically trying to create a safe container. I mean, as much as possible, for folks to have the openness to state, hey, what happened was really harmful. You know, you caused harm, and and to really humble myself, to really listen actively, to not get defensive. I mean, these things are so simple, and yet it's so easy to get defensive. But it's really about active listening, not getting defensive, really self-examining, doing a self-examination of like, okay, let me really think about what I did and the impact that I made. Because intention is intention, right? And maybe I didn't intend to, but impact is more important. So it's such a really, listen, to apologize, to validate those person's feelings are all incredibly critical. And then finally, what I would do is to really like work with that person to say, what can we do here moving forward to um, to get to a place where there can be healing. And sometimes the person is going to be willing to go there, and sometimes they aren't. And so, it's really on my end, it's staying open and taking ownership for what's been done.
I absolutely love that, and I see that very much from the way you described it, from a very individualistic standpoint, right? Like thinking about your intention versus your impact. Holding yourself accountable. But then, as you said, being very open and trying to be on that process towards healing. I'm just wondering, if organizations are capable of doing that.
Mm.
Because as an individual, you are, you can see you're passionate, you're compassionate, you have those personal values. But how do organizations navigate that if they've stepped in the proverbial quicksand and caused trauma to a community, and then have to step backwards?
Well, I think a perfect example, we saw what happened, after George Floyd and like Black Lives Matter this surge that we've had in the last 2 years of really getting the message out to organizations that you have to be more anti-racist. These organizations have had to do that examination to figure out, okay, we've done all of these things that are harming communities. Now what do we do? And so I think, some things that can be done, um, depending on how many resources an organization has, is really to hire consultants that know about, diversity, equity, and inclusion, to have a really solid plan for what they can do moving forward, and to then be really proactive in doing those steps. So it's not just about putting out a letter, on your website that says we're anti-racist and this is what we're going to do. It's really showing the communities that they're actually taking action on this, in really meaningful and intentional ways. And so, yeah, I don't necessarily have any personal examples, but I have seen it done in, decent, good, and really great ways, where people have changed their hiring practices, for example, or, organizations have started to offer more education in order to create a more inclusive space. I've seen organizations using trauma-informed frameworks in order to make sure that folks are feeling more safe. So, I don't know if necessarily that addresses your question, but these are some of the things that are kind of in my, in my brain for how an organization can, on a wider scale, really move forward with, acknowledging the harm that has been caused, but then really actively reversing the practices that were causing harm.
Leanne, you more than answer my question for sure. And as someone who, strives to be a good anti-racist myself, I understand that. And I'm thinking about an organization, very large one, that I won't name, that had this particular struggle. And I remember, sitting at a committee, and they were discussing, well, how can we be, and they didn't use the term anti-racist, but essentially everything else that they were saying, it kind of got down to that just how can we be more anti-racist? How can we have, more people of color, more diverse types beyond the prototypical white male, engage with our organization. And it was very interesting to kind of see the conversation and like the struggle, kind of the loops back and forth. And because it was a mostly white organization, and so I'm thinking about what you said. It's like, okay, hire some consultants, get the help. This organization for sure could afford to do that. And for some reason, they weren't quite there. They were still trying to figure it out internally with their non-diverse, cadre of employees to figure out that anti-racist diverse solution with a body of people that did not represent whom they wanted to serve. So then my question to you becomes, if an organization, say, can't hire consultants, say for anti-racist work or some sort of work where they want to reverse the harm that they or their past colleagues organizationally or historically have caused, are there other solutions out there? And I'm sorry I'm putting you on the spot for this, but I'm enjoying the conversation.
Absolutely. I think there are a lot of different solutions. And so the first thing that comes to mind that I would do, if they're not able or willing to hire consultants to really flesh through like a plan, what I would do at that point is I would hold a town hall. I'd hold a town hall. I'd invite folks to come to the table to provide feedback. I would then take their feedback and I would turn it into actionable goals and steps that can be used to transform whatever structure in place is not working. I mean, they have to be willing to do it, I think. Like it's not going to work if this organization, for example, that you're referring to, is unwilling to examine the structures that are harmful or that are exclusionary. And so I think the first step is that, you know, they have to be willing to hear the feedback, and they have to be willing to make a change. If they're willing to do that, then yes, I think there's lots of things that they can do. But the main thing is they have to listen. They have to listen to the folks that have been affected, and they have to, like I've said, they have to humble themselves and listen, and then really consider, okay, that these folks that are giving us feedback, they are important. They are important stakeholders to this organization, and therefore their needs need to be considered. And so once that town hall is held, they've gotten the feedback, they've written up summarize whatever feedback was given, then they need to work on those actionable steps.
Absolutely love that. And if I happen to, interface with some of those individuals, I might just kind of drop that town hall idea on them, because I really love that one. Switching gears just a little bit. So, you have self-identified as a Chinese immigrant and a queer woman of color, proud queer woman of color. The Boston Congress of Public Health, we are all about social justice, not just public health. And so thinking of those communities that you come from that I mentioned, or any others that I may not know about that you might want to share, what are, I guess, some top of mind public health and or social justice issues for those communities, and I guess things that you'd like to see, moving forward?
Oh, that's such a big question. Of course, we've mentioned several communities. So I'll start with the queer community. And it's so obvious right now because there's so much legislation on specifically the state levels that are coming out right now that are clearly harming our trans community members. And so that is a huge public health issue. And I remember when I was in school and I wrote a paper about some of the health disparities among the trans community and what we can do to really support them better. And my teacher's feedback was the trans community only makes up like 0.5% of the, whatever general population. You need to think about the resources that you have and really maximize your resources. Like you might not want to choose the trans community because, you're only affecting this many people versus when you can use these resources to affect so many more people. And I thought to myself, no. I mean, I get that. And that's a very important public health issue to muddle through. And I don't think that is the only way to think about public health. The trans community is still, although smaller when you compare them to other community groups, are when you zoom in at some of their health disparities, it's insurmountably worse. I mean, I just the amount of hate crimes that we have seen in the trans community is it just disproportionately affects the trans community so much more than other communities. Some of the policies, the very conservative policies that are coming out, are harmful. I mean, it's harmful to everyone, really. It's not just harmful to the trans community, it's harmful to everybody. Whenever we're doing anything that excludes a group of people, it's going to hurt everyone. And so what I would want to highlight and what I would want public health to really focus on is how can we, within our power as a industry, support our trans communities around the country, especially when they're given messages that that their rights and their existence should not exist, should not be acknowledged. So that's really the first thing. Did you want me to mention a few more?
If you'd like to, but I think that one's also powerful as well. So it's totally up to you.
Yeah.
So as you're thinking on it, follow-up question, so you may, or I'm not sure if you're familiar with the comedian Dave Chappelle.
Oh, yes.
Okay. So I didn't want to make any assumptions there. And so one of the things that's very interesting is Dave Chappelle's, frequent usage of humor, sometimes disparaging, humor with the trans and or the rest of the LGBTQ community. And so I'm curious from your perspective, because I think there might actually be some controversy around this. That there's some people that say that there should not be humor or jokes made about the trans community, versus there are those that might say that Dave Chappelle or other comedians actually are helping to elucidate a community that might in fact go ignored. So I'm just curious from your perspective, kind of your take.
Well, I think two two thoughts that I want to share about that. So the first thing is I'm definitely in the camp of there are ways to talk about the trans community in order to educate, other communities about trans folks and to normalize the idea of um, being transgender. I don't think that comedy, especially in the way that Dave Chappelle is doing it, is the way to gain more public acceptance of trans issues. I think what it's serving to do is to paint a stereotype, and especially a negative stereotype of trans folks. So
Mm-hmm.
that's going to then lead to people making more assumptions, and create more harm. So I do think that even in comedy, that there can be ways to spread awareness. A lock is doing a really great. I mean, they are a comedian. They're trans non-binary. They're a comedian, and they're mixing comedy with discussing social issues and gender identity issues. And so I think that is it is a healthier way to educate the masses, um, and doing it in a way where we're using the proper language or the more affirming language, and really helping to see trans folks in a positive light. The other thing that I want to say, though, is I actually have a lot of compassion for Dave Chappelle because,
Mm-hmm.
he, from what I've heard, suffers from his own mental health issues. And so, regardless of what he's saying, I, I would, I wish for him to get the, support that he needs. Yeah. Anyway, that was a little off topic, but I think what I'm trying to say is, like, we're all human, and just because I don't think it's appropriate for Dave Chappelle to be talking about trans folks in the way he is, that he is still deserving of the same compassion and um and acceptance that we all are, because then what are we modeling when we say, okay, no, we're going to cancel Dave Chappelle? He's going to talk poorly about trans folks, we're going to cancel him. That's not the way. So the way, and Dave Chappelle is just one example, but there's so many other folks out there that have misperceptions of, let's say, just this trans community, since we're using that as an example. And really, the way is to really have these conversations with them where we can relate to them, and where we can, even if we can shift their mindset just a little bit, using their lens, I think it's a job well done.
Yeah, and it's so interesting, just this discussion we're having, about Dave Chappelle and him talking about the trans community, and how it goes back to what we said, that even if the intention may be one thing, the inadvertent harm that you may be causing, the misperceptions, the stereotypical, like, thinking about a community, So thank you so much for sharing that. It's just so interesting to kind of have that little kind of pop cultural discussion as we're talking about these things.
Yeah.
So I wanted to get back. So you said from Boston University you have dual degrees in both public health and social work.
Mhm.
And one of the values of the Boston Congress of Public Health is that we believe in intersectional public health. So not just the bread and butter public health that people think of, where people are doing things in infectious disease, epidemiology, maternal and child health, sexual and reproductive health, health policy, health management, but also things like social work, dentistry, pharmacy. So I just wanted you to comment on, for any other people in the audience who are social workers who may not be currently engaged in public health, or people who are interested in the field of social work, just kind of your take on how it intersects with public health and contributes to the field.
Oh, I can't speak more highly about the marriage between social work and public health. I think that they complement each other so perfectly. I have no regrets about doing the dual degree program. So I landed in public health. However, I am daily using my social work skill sets because in public health, I'm still working with lots of different people. I have my colleagues, I have the people living with HIV that I work with. So I'm still working with all types of different folks, and having those skills that I learned from my social work program allows me to have better relationships with all of the folks that I am working with. And so, vice versa, public health needs social work. Public health, um, where sometimes we're very data driven and we're very, okay, let's look at the macro level. Um, but they still have to work with people too. So, having those skills on how to relate to people in a deeper way lends itself so perfectly to some of the macro work that public health that is a part of public health. So I would highly recommend doing both degrees. If you're going to go into public health, you got to get that direct service experience so that you can more effectively work with people, especially if you're on the ground. And for social workers, having the research skills, knowing more about project management, knowing more about evaluation, knowing all of those tools is also so critical when you're working with your clients and looking at the bigger picture and the bigger systems.
I love that. Thank you so much for making that linkage, for the audience. And as I said before, our organization is looking to really highlight how intersectional and expansive public health is. So I think you did it justice, and just the tip of the iceberg too. I'm sure there's a lot more out there as well. So switching gears, Lianne, can you tell us something that's been like one of the most inspiring moments in your life and or career?
Oh, wow. The most inspiring moment in my career. Well, I actually think I gave you my example already, which is working with, okay, so I can say more. So the most inspiring moment of my career has been when I started working with the COVID response team within the Alameda County Department of Public Health. When I first entered into that team, I was working at a mass vaccination site, and there were hundreds upon hundreds of people there, all working together to get people vaccinated. So it was this operation was like nothing I've ever seen before. I mean, it was just it was so impressive to me. You had FEMA there, you had the State Department there, you had the feds there, you had all the translators were there. There you had, the counties were there. it was, you had the National Guard. So the idea of bringing all of these stakeholders together to work together to operate this huge operation was just incredible. And it was so inspiring to see these folks who they were exhausted. They had started in February. I had met them in May. They were exhausted, but they kept going because they care. They care about this issue so much. And it was considered, it is still, I mean, it still is considered a public health emergency. And so to see them every day coming to work, doing what they're doing, and then having to all of a sudden shift, they have to literally, like, a new policy comes out, and you know, and something changes, and we have to all of a sudden shift everything we're doing. And to see them just say, okay, start over, start from scratch, go back to the drawing board, this is what we're going to do. And to have to plan it out in such a short period of time, you know, it's like a fire drill every day. So to see these folks able to do that and to do it so effectively was just so inspiring to me. And I only hope that I can continue to work in that way where I can be flexible to the changes in our environment in order to be most effective in reaching whatever that goal is.
That actually gave me goosebumps. I like very vividly imagined that whole scenario, and I have participated in larger kind of vaccine dissemination programs that you described, but nothing to that level. So thank you. That was beautiful. I'm going to say conversely. Can you tell us about one of the most challenging moments in your life and/or career?
Well, I think I will talk more about something that I mentioned at the beginning, which was 2021. We're in the middle of COVID. Everybody's having such a hard time. I'm no exception. So personally, like I had said, um, you know, my mother lost her battle to pancreatic cancer, and I had lost my job, a very stable contract, um, that I thought that, I mean, I was in line to get a promotion. The day that I was supposed to sign my contract to get a promotion, the contract was taken away from me, and I didn't have time to say goodbye to any of my community members that I had been working with. It was like, you're done at the end of the day, you know, you won't get paid afterwards. So there was no continuity of care. And that that happening so close to when my mother died, plus me sort of ending a relationship, just, I mean, I couldn't really, I didn't recognize myself anymore. And so this is the dark night of the soul that I was referring to. And so I had to really be okay with the fact that, you know, I'm still someone of value, and that even though this identity that I once knew myself to be, you know, working, you know, in this particular contract, I, that, you know, there's a reason why I'm not supposed to be doing this anymore. And that, you know, this door has closed and that another one is going to open. And then I have to be open to that while also having compassion around my own grieving process. So I think I bring this up because even though there's a lot of personal things in there, that, you know, I think my advice really is, when unexpected things happen, especially when it's your career, you know, you think you're this person. You know, I thought I was working in HIV. I was this project manager for this planning council. And all of a sudden, you know, it wasn't in my control. And so my advice is really um, that it's okay. It's okay when things don't go as planned, because something else will come up. And that other thing that comes up is could be even better, or, you know, shows you other parts of yourself that you didn't see before. Um, and that it's okay to it's okay to let go of the past. So
That is great, and I love that, you know, regardless of, I mean, for sure, all of the things you had to go through, your mom, losing your mom to pancreatic cancer, the job, the relationship, that it was truly transformational, for you, and would you say that, who you are now, like you are who you are now because of that moment?
Exactly. The analogy that I like to use is that I had to go deep into the dark forest to get lost in order to be found. And I
Mhm.
can tell you that, I have changed a lot, that I can recognize myself now, that I am inherently different
Mhm.
than I was before, and that I um, have more lessons in my toolbox that I can use moving forward. That is making me a stronger person.
Love it. Love it. Leanne, as we are about to close out, I just had 1 to 2 more questions for you. So you are, one of our 40 under 40 Public Health Callus Awards winners for the Boston Congress of Public Health inaugural cohort. Um, is there anything that you can envision, that this cohort could do, or anything that you might see in the evolution of the cohort and of the award and the celebration of people at various intersections of public health and social justice?
I think we are already doing it, and I am excited about the amount of advocacy that this cohort is going to continue to do in terms of achieving different types of social change. We are, as a generation, a very motivated group of young folks who are very passionate about creating a healthier world, a more integrated world, and there's no stopping us from what we are capable of advocating for on all levels of our social structures. And we're going to need people in policy. We're going to need grassroots folks. We're going to need folks that are just working within their own communities and people that are willing to work in the systems. So, together, if we are represented in all of these different structures, there is no stopping us from achieving the the structures that we want to see that make our societies better, healthier, and more cohesive.
That is great. And so everyone, you heard it from Leanne Hope. There is no stopping the 40 under 40 Boston Public Health uh, uh, winners in what they want to do in making the world more just, more equitable, more compassionate, more open, and many of the other values that Leanne has espoused. So please go to bcph.org 40 under 40 to learn more about Leanne Hope as well as other 40 under 40 winners. And if you want to learn more about public health topics and other things in social justice, go to our journal, HPHR Journal, formerly the Harvard Public Health Review at hphr.org. Once again, thank you so much, Lianne, for being a fantastic guest. I love, love, love this interview. This is great.
Thank you so much, Dr. Carpenter. It was wonderful speaking with you.
Okay. Till next time.